Welcome to the Cincinnati 2030 District 50% Solutions Series. I'm Elizabeth Rojas, and I'm the 2030 District Director. And today we are thrilled to have Dr. Angela Loader and Dominic Ramos-Ruiz joining us from the International Well Building Institute. This is a really exciting time for us because the work that the well building has been working on with relationship to COVID and really advancing education around occupant safety is very important and timely. So the Cincinnati 2030 District, as many of you guys know, is adopting a health pillar to our metrics. So we have, while we're reducing our energy and our transportation and our water, we are working with IWBI to craft our health pillar so that we can increase the occupant health. And so this is very important, especially as we start to move back into the workplace and trying to figure out how we navigate some of the issues that are related to addressing occupant safety and making reductions in our building energy. And oftentimes those are opposed. So we are really happy that we get to offer some of the education around supporting our members through this very difficult time. So I'd also like to say Tom Schultz here is our data analyst, and he'll be taking questions in the chat box. So please feel free to show your faces. We would love to see you today. But if you wouldn't mind, please mute yourself. And then at different times during the presentation, Angela and Dominic will let you know when they're opening it up for questions. But if you have questions that you'd like to ask at any point, please go ahead and put those into the chat box. So without further ado, I'll turn it over to Angela and Dominic. Thank you.
Thank you. Hello, everybody. We're really excited to be here today, and we've got a lot of information to show you. I wanted to give you a little bit of sense of what we're going to talk about today. We're going to talk about this context that the buildings and the health around buildings has been increasingly important, really risen to the forefront here. We've been told that not all of you might be familiar with WELL, so Dominic's going to give us a really brief sort of overview of what we do and why we're involved in this. And then we're really going to talk about how we mobilize our community based on what our community is asking us around how can we trust our buildings, what policy should we have around mental health, returning to work. And then the majority of the time we're going to be spending on is around the strategies, evidence-based strategies that use existing well building features that you can apply at any time to help you deal with COVID-19 under prevention and preparedness, resiliency, and recovery framework. And so that's the majority of the time, and we are trying to leave time for some questions in between those sections. So, of course, we're in the middle of a pandemic. We've been hearing daily news updates on this. But one of the most important things that we know about it is that it can impact everybody, but certain populations are more vulnerable than others. So the elderly and those with comorbidities such as heart and lung disease and diabetes tend to have a higher mortality rate when they get sick and tend to get sick more often. This is interesting because for a long time, we have tried to get buildings in our communities better designed to deal with chronic disease, which is the vast majority of things that we deal with. And these lead to things like heart and lung disease and diabetes and obesity. But we haven't been that successful. What has traditionally been the most successful in changing the way we build our buildings and design our buildings and our cities has been infectious disease. That, in fact, was, outbreaks of cholera and other types of infectious disease was the #1 reason why we reduced our overall mortality rate back in the 1800s and early 1900s. So we're seeing this convergence of infectious disease and chronic disease because of these comorbidities. And it's a real opportunity to rethink how we build and design our buildings, how we ventilate them, how we clean them, and how that extends out to the city. And given the indication from research on that this is not going to be the first pandemic we're seeing, it's going to be a rise in zoonotic diseases, the kinds of adaptations we can make now to make us more resilient and better prepared next time really are worth the effort. And I'm going to pass it over to Dominic next to give you a bit of a background on where WELL stands and what we do before we talk about how we've responded to the COVID-19 pandemic.
Thank you. So for those who may not be familiar with our organization, the International Well Building Institute is a public benefit corporation whose mission is to improve human health and well-being through the buildings and spaces where we spend 90% of our time. And that number is probably closer to 100% for many of us over the past few months. But since 2014, we've been advancing this mission through a platform called WELL. And WELL is a performance and evidence-based system for measuring and improving the health impacts of buildings through 10 core areas, shown on the next slide.
Oh.
And
this one? Yep.
Yep. And WELL is comprised of over 100 building design, operations, and management interventions that can be prioritized based on your building type, location, health needs, and our goals. On the next slide, you'll see generally how the structure is, and many of the features within WELL and within those 10 concept areas that Angela will go into a little bit more detail in a moment. A lot of them are linked to global health data through the Institute for Health Metrics and Evaluation, or IHME. These interventions on the next slide are verified. Sorry, actually after that one as well. These interventions are then verified by a third party through on-site testing to ensure performance and accountability over time as it relates to occupant health. And it's really this part that is so paramount and particularly critical in the present moment as we look to reopen our buildings and communities, whether that's in Cincinnati or another city around the world. And it's also important to note that on the next slide, next one, it's really important to note that this movement and our rapid response to the current crisis wouldn't be possible without a growing community of projects, countries, cities, advisors, and accredited professionals that now expand over 85 countries. Because building owners, operators, and designers shape our built environment, as many of us are very aware, and can have a profound impact on our health. And if you go to the next slide, you just get a sense of the network that the WELL community encompasses and how many people are working every day to advance these solutions through our built environment. And for the next slide, this is really why WELL exists as a tool for people to be agents for public health. And while they cannot prevent a pandemic, they can certainly help to reduce the spreading of infectious disease. And that's why we're here today. And that's why I'm very pleased to pass the presentation back over to Angela for a deeper dive into how we can respond to this in Cincinnati.
Wonderful. Thanks, Dominic. So as you saw from Dominic, we're a global company, and one of our offices is in China. Actually, a huge market of ours is in China. As you may imagine, the coronavirus hit them first. And it was really their initial response to their community saying, well, how do we know that our buildings are safe? What can we do about this? That they took that first stab at some of the existing WELL strategies and said, hey, what of these could be applicable to coronavirus, that we later took and looked at new research and developed into the strategies you're going to see today. And they had a huge level of participation. Over 160,000 people in 1 month were tuned in. And so this moved across then to Europe, and then of course came to the US. And we've been fielding questions such as, how will indoor air quality and building hygiene monitoring shift in a post-coronavirus outbreak world? How will office air quality be safe when I return to work? What can employers, community organizers, schools, and parents do to help cope with mental health issues associated with quarantine? And even say, at higher education institutions, how can we manage risk now that campuses are closed? So it's these kinds of questions that kept coming at us because of our role of managing and our platform of the WELL Building Standard that really led us to develop this Places Matter initiative. Now, why do we call it Places Matter? Part of the reason is because we know that location matters in infectious disease. So some research has shown that latitude and climate can influence vulnerability to COVID-19. I am located in Denver, where it's very dry, and apparently this is not so great because viruses tend to love dry air. But more importantly, we are spending almost all of our time indoors. So the places where you spend the majority of time indoors is really an opportunity to be able to use that building, for better or for worse, to help deal with infectious disease. And quarantine and work from home are highlighting how well our spaces are working or not working in many cases of our daily lives. And we also know some previous lessons from healthcare, such as influenza outbreaks, the importance of airborne infection isolation rooms, or AIR. These point to the importance of buildings in mitigating disease transmission. And Dr. Joe Allen, you may have seen him interviewed on a whole bunch of different news networks or articles in Forbes and the Washington Post and New York Times. He's really highlighted this, saying if buildings are managed poorly, they can spread disease. But if we get it right, we can list our schools, offices, and homes in this fight. He is one of our co-chairs on our task force that created. This has many co-chairs and over 500 global respondents, and they had two main goals. The first one is to inform new guidelines for prevention and preparedness, resilience and recovery around infectious respiratory diseases, and we are working on those right now. And the second goal is to inform enhancements to the well building standard itself, again, which we hope to release in August. We're really excited about this. We're almost at the brink of releasing our well building standard out of pilot for V2. We stopped the process, said, hold on a second, we really need to take another look at this. And so the version that you will be seeing has had the look of these incredible co-chairs. You've got Dr. Richard Carmona, former Surgeon General of the US. You've got people that were on the front lines in China. You've got the head of Occupier Business Performance, Cushman and Wakefield, Despina Tsisakis, a whole bunch of people here that have lent their expertise to be able to make sure that the well building standard and these guidelines are the most robust possible and really help give you that extra tools for prevention, preparedness, resilience, and recovery. Now, why do we call it that? So I'm going to talk to you just for a moment about frameworks for thinking. These are the strategies for the well building standard, and they were designed, there's 8 strategies. Here we go. So there's promote clean contact, improve air quality, manage risk and create organizational resilience, support movement and comfort, including work from home, strengthen immune systems, maintain water quality, foster mental resilience, and champion community resilience and recovery. All of these are based on evidence, the latest available evidence, which we know is changing all the time, but this is the best available evidence, as well as linking to well features. Now, Dominic is going to give you a link to these strategies. You can download the PDF for free. So we're not going to go, because we're short on time today, it's just a short session, we're not going to go through every single sub-strategy, but it's all there in that PDF that you can follow along or refer to later.
And not to, sorry to interrupt the presentation, but I believe that the slide view is showing not the full slide, just the presenter view, maybe.
Oh, is it?
Sharing. Yeah, I apologize.
No, thank you for telling me.
Our Midwestern ethic prevents us from interrupting.
Please tell me. Is that better?
Yeah, it's much better. Thank you so much.
Oh, please tell me if that's happening. I've got 2 screens, and Zoom is not always cooperating.
Thank you.
Thanks. Sorry about that, everybody. So I want to just spend a minute or here on why we chose this prevention and preparedness, resilience and recovery framework. This is a modified emergency preparedness framework. And really we frame these under this because many of you are going to be thinking about, okay, when the next pandemic comes, how can we make sure to prevent the spread of infection or reduce the chance of spread of infection? Many of you are potentially looking at recovery. How do we go back to work? I'm sure all of you are looking at resilience. How can we increase the resilience of our organization and our workers to be able to come back to work? So prevention in the context of infectious respiratory disease is really reducing the possibility of infection. And key components of prevention include hand washing, isolation of those that are sick, cleaning protocols, and ventilation strategies. So we haven't put those strategies into each of these pillars, but you're giving a sense and overview here of which of those 8 strategies we're going to go into in just a minute would fit under these 4 pillars. So this includes design, operation, and policy strategies to support cleaner air, cleaning protocols, and individual behavior and immune change and immune support. And this really is a risk management approach balanced with a health promotion approach. So it's not just taking away the risk, but it's also trying to make sure that you've got the strongest, most resilient immune systems to start off with so that you're better able to weather the next storm. For preparedness, this is really reducing the impact of pandemics. And preparedness, we've seen, is a key differentiator to reduce the spread of infectious disease. And in fact, those countries that have had experience with recent pandemics and infrastructure and policies that are better prepared, for example, Taiwan and South Korea, have had much lower death rates than those organizations in those countries that have not been nearly as well prepared. For resiliency, really the goal here is to lower the impact of pandemics and shorten the recovery time. So resiliency is a key framework used by industry, policymakers, and academics that really increases your chance of weathering uncertainty and change. You might use a different framework, for example, if you're using, if you're looking at so ESG, so environmental social governance, but most of you will be familiar with some kind of risk management, and resiliency here is a good thing. Resiliency can be used at multiple scales. So there's the individual scale of resiliency, say for immune systems, there's your building scale, community, city and region, and especially organizational scale. And of course, better resiliency can improve recovery. Lastly, recovery. So these are actions taken to support individual, organizational, and community capacity to recover quickly and adapt to the new normal. I think none of us are thinking we're going to go back to the way things were. Key here is that it needs to be scalable, adaptable, and flexible to help speed and support recovery. And key strategies that would fit under a recovery plan include supporting individual mental and physical well-being and providing opportunities to connect with and support both organizational and community level recovery. And really important here is lessons learned should be used to evaluate and revise prevention and preparation plans for the next emergency. So this cyclical evaluation and data gathering is a key component of that. So let's dive in. The first one here, the first strategy is promoting clean contact. So we know the goal here is to reduce exposure, and COVID-19 is spread via respiratory droplets from an infected person. Of key note here, the latest research is showing that it doesn't necessarily have to be just from coughing or sneezing or talking, that even being in the near vicinity, it can remain airborne and can remain, therefore, settle on surfaces and be in the room for up to 72 hours airborne. Different research says between 3 and 4 hours. So of course, maintaining good cleaning protocols and hand washing habits can support individual and organizational resilience. Soap in this instance, I want to make a note here, has been found to be more effective than hand sanitizer in community or non-healthcare settings. And that's mostly because people don't tend to use enough hand sanitizer to make a difference. Of course, if there's no soap and water available, hand sanitizer will do. Again, the strategies here to reduce exposure to pathogens, allergens, and hazardous cleaning chemicals is hand washing. We have protocols around hand washing and features there, as well as cleaning products and protocol for well features. The second feature here, or strategy, is improving air quality, and this is a big one. We know that air stagnation may concentrate airborne viruses or dust, and increased ventilation in the building can reduce the chance of influenza. There was one study done that increasing the building's ventilation to the above minimum standards was the equivalent to having 40 to 60% of the population vaccinated against influenza. Huge deal. And so we know that without proper maintenance and filtration, that heating, ventilation, and air conditioning systems can build up mold and particulates that can propagate respiratory diseases. This is a huge debate right now, and making sure that buildings are safe. And there's some very promising research that maintaining a relative humidity between 40 and 60% may help and limit the spread of COVID-19. In fact, it's such a hot topic that there is a petition right now to the WHO to include this as a potential well strategy. So as an overview here, these key well strategies would fall under these two strategies for improving air quality: ventilation effectiveness, enhanced ventilation, operable windows, air filtration, microbe and mold control, moisture management, and humidity control. Now, at the end of each of these two sections, we're going to have a chance to have a question or two, and Dominic is going to lead us with that.
So with one question to kick it off, one that's oftenly asked, what should people, or how often rather, should people be cleaning or sanitizing their hands or even surfaces within buildings? And what are the best practices? That's
a really good question. So ideally, you would clean it and sanitize it regularly enough if people are touching it. The problem is, as soon as you've touched it, then it's contaminated again, and it's simply not effective that every time you touch a building that you're going to sanitize it. The better thing is to up your cleaning schedule, and that will depend on your capacity and how many people cycle through the buildings, what your ventilation system is. But a good strategy to have, in addition to that enhanced cleaning protocol. You probably have gone grocery shopping and noticed that they've got more staff doing regular cleaning, is to also ensure a mask protocol and to have people wash their hands regularly. There's a lot of other design solutions that are being discussed, but one of the most important things there is to increase your ventilation systems. You've got maximum airflow, natural ventilation if possible, to enhance that airflow and get it out of there instead of just trying to kind of clean up after the fact.
And do we know how long a disinfectant is needed in order to disinfect? Is there a certain amount of time that it takes?
Well, this might not be common knowledge, but any disinfectant needs to be left wet, and each disinfectant will have instructions on how long that needs to be, and let it be airborne before wiping it away. So if you spray it on and then wipe it immediately, that's actually not that effective. Okay,
I think we
wonderful. Do we have enough time for one more question, or should we move on?
I don't see any questions from the audience. We can go ahead and move on.
Perfect, and we hopefully will have a few minutes at the end of this session. So let's talk about the third strategy, which is managing risk and creating organizational resilience. Now, here the main goal is to prepare for emergencies. Emergency preparedness, of course, as we know, is a risk management approach that enables rapid response. We know, for example, the organizations that already had some remote work staff, or that had plans for remote work or policies around remote work, even the equipment and the technological capacity for, say, web-based programming and online meetings, were much better prepared than organizations that simply hadn't even done a remote work, had no organizational planning. They were really left scrambling at the beginning when it was just basically a global remote work from home experiment. A key component of this, as mentioned earlier, is that organizations should regularly reevaluate their emergency preparedness plans, and adaptability and flexibility are essential components of this because we can't possibly predict everything. A key thing to consider in the case of COVID-19 is support for working parents or any caregivers. Because of global school closures, it's estimated that 94% of children worldwide were out of school or out of care. Many professionals are full-time caregivers at home and are struggling to balance responsibilities. This can greatly impact their performance as well as their mental health. The second key component about this is being informed by evidence. So regularly capturing occupant feedback can help inform emergency protocols and address topics like worker performance, satisfaction, and well-being before, after, and during the period of remote work. So for the well building standard, we require all well projects to do a post-occupancy survey, and some can choose also to do a pre-occupancy survey to help evaluate the effectiveness of the current strategies that are deployed, identify current mental health challenges, and inform new strategies. So just imagine for a moment that your organization already had a sense of, say, the mental health or potential stress points in your organization. That then enables you to be able to deploy resources effectively during a pandemic. Let's say, for example, you knew that there was a highly inactive population, right? They needed a lot of exercise. You might be able to pinpoint extra resources to try to get them active when they're stuck at home. Or if they had a high stress load, you might try to prepare extra resources to help with caregiving or to help have more flexible hours for people to manage their responsibilities. So the key strategies under this strategy, sub-strategy, and features are preparing for emergencies. That's an emergency preparedness feature and the family support feature, and being informed by evidence. This is our core precondition, which is the occupant survey, as well as enhanced occupant survey that include pre-occupancy surveys, interviews, focus groups, and other methods. So the fourth strategy here is supporting movement and comfort, including working from home. We know that data is scarce. There's some indication that up to 44% of companies globally did not allow remote work at the point of the pandemic. And organizations may not be prepared to provide guidance to their teams as how to create a functional and comfortable home workplace and work from home experience. A key component of this, of course, is ergonomics. So ergonomics, for those of you that don't know, is the study of how the work environment meets the user's needs, preferably without injury, and understanding how to provide remote work ergonomics and support for physical activity and movement throughout the day is key. So for example, right now, I'm trying not to move too much, but I am sitting in a ball. I often work also from a balance board at a standing desk. So I have a full-time remote work office that enables me to be flexible, but there's many people that are crouched on the kitchen table or they're sitting in a chair that doesn't support their back. And that not only doesn't encourage them to move very much, but it's a recipe for long-term musculoskeletal issues, which, as we know, is one of the key reasons people miss work. So while it doesn't directly address work from home scenarios, many of the strategies that we talk about can be newly applied for home. So for example, we have features on visual and physical ergonomics, active furnishings, enhanced ergonomics, and self-monitoring. For example, wearing a Fitbit or other wearable that would encourage you to get more exercise or get up and move, particularly from sitting. And we have a few moments for questions as well from this section.
Sure. And Angela, would you briefly discuss the occupant surveys and what WELL considers sufficient in terms of response rates to merit instituting different policies?
Absolutely. So we don't, because it's a precondition in order to get certified, we don't say if you don't get a certain response rate, you can't get certified, because that's leaving a lot to potentially you might have a poor response rate. We do have many strategies in place and recommendations to encourage a higher level of response rate. And we strongly encourage organizations to use a third-party survey provider that have expertise in how often send reminders. It gathers trust, right? If it's somebody third party that's objective and neutral, we know that they maintain the data privacy. We take it very seriously, but the privacy of individual respondents and organizational privacy, there's a higher chance you're going to get a response rate, as well as if organizations say, hey, if we get a certain level of dissatisfaction, we're going to take plans to do something about it. So let's say if we hit more than 50% dissatisfaction with comfort, like the temperature in the workplace, we're going to institute a plan to be able to talk to people and rectify that. In terms of response rate, generally speaking, obviously the higher response rate, the better, but if you can aim for more than 50%, that's pretty good. We try to make sure that all our occupant surveys, we work with our survey providers, range between 10 and 15 minutes. So not a huge lift, that's once a year. And this is the first time we've done this, that we've seen anybody do this, is that it combines facilities management information, HR management information, such as are you satisfied and use workplace wellness policies, how is your health status, as well as IEQ satisfaction and overall design satisfaction. So you're getting invaluable data from your occupants one time a year that you could then build on and make decisions on where to invest your time.
Great. Just one last question. As many organizations look to improve their organizational resilience and recovery, what has data been telling you about the different options for the return to work?
It's a really good question, lots of potential answers. I would say that the first thing is that all evidence is showing that 6 foot alone is not enough. The virus can remain airborne for much longer than that. Unfortunately, the data that the CDC is using is based on data from the 1930s, which they didn't have the technology to be able to manage airborne disease. If anybody wants to stay up on the latest on what that research is, Lindsay Marr and Joe Allen and Dr. Richard Corsi, all of them are PhDs, on Twitter, actually, of all places, have constantly posting the latest research. What they're saying is maximizing ventilation, social distancing, trying to have physical barriers, masking if appropriate, but any length of time spent indoors increases your risk. So going to the grocery store, you're not there for that long, probably not a high risk. Sitting for a long time in a restaurant, for example, with closed ventilation, sitting very close together with people at work, higher chance, a higher risk. Out of thousands of studies in China, only one was caught outdoors, and in Japan, almost none of them. So the vast majority of cases have been transmitted indoors. Most organizations are looking at a combined remote / in-person back to work program, and it's really, and there's some great guidance on that so far. Now, some of the plans look at really increased flexibility, particularly for those that are juggling caregiving responsibilities, to enable them to be able to effective at work and not burn out. And the last thing I'll say is it really is challenging a lot of very popular design principles, such as open plan offices, hot desking, very close spaces. We're going to see some changes in which the office may not be full. There's some great thinking on that that's been done by some top real estate companies, and we're going to be looking at some of those issues as well in the guidelines coming out.
Excellent. Thank you.
All right, so let's get to this fifth. I want to make sure we get through these strategies and leave some time for questions as well. The fifth strategy here is strengthening immune systems. Now, of course, technically having a strong immune system would fall under any of those four pillars, but it is a really key part of really in the fight against COVID-19. So one of the key things here, of course, we focused aside on smoking. Those who have smoked have chronic or have chronic obstructive pulmonary disease, one of the top risk factors for chronic disease here, are at increased risk for developing COVID-19. So again, this is one of those places where chronic disease is really overlapping with your risk of infection and your risk of dying from an infectious disease. We know that smoking is associated with multiple negative health outcomes, such as reduced life expectancy, respiratory infections, coronary heart disease, and cancer. So this is one example where encouraging reduced smoking or reducing your exposure to secondhand smoke really can help give your employees, if we're talking about employees, really help to reduce their risk and strengthen their immune system. The second key component that we decided to highlight today is healthy sleep habits. So you may have seen some research just showing that, at minimum 8 hours of sleep, at least to get your brain healthy again, is recommended. And we know that poor quality sleep or not enough sleep, which is a bit of an epidemic on its own in the US, has been associated with a range of negative health outcomes, including impaired immune function. They've done very depressing studies that even one night of poor sleep can really impair your immune function the next day. Not good news for those with small children. But really having policies and programs to encourage healthy sleep habits, particularly when people have a difficult work-life balance right now, is really important and a great way to improve their immunity. We also know that exposure to daylight and circadian lighting design has been shown to have a positive impact on sleep quality. We know that being exposed to blue light in the morning and kind of cool or warm light in the evening really helps set your circadian rhythm and trigger your production of melatonin. So avoiding screens at night, having workplace policies that reduce that kind of chance you're going to be answering emails at midnight, all can help improve the immunity of your employees. So some of the strategies to strengthen your immune systems, you can see why we didn't go over all of them today. It'd be too much for this session, but making sure you offer physical and mental health benefits. So that includes health services and benefits at a minimum, including mental health support. There's been some people who have been talking about an upcoming mental health crisis, and that making sure that your employees have access to these mental health services, often virtually right now, is really important. And creating a culture of health, so promoting health, talking about health, making sure you check in about your employees' health, of course, respecting their privacy, really important here. You've seen, we discussed and highlighted today the discouraging smoking sections, also nourishing and hydrating, so encouraging fruit and vegetable promotion and water promotion. I will say, everybody knows you're supposed to eat fruit and vegetables. The more that I learn about exactly how many health benefits fruit and vegetables have is pretty incredible. So encouraging a healthy diet, harder to do, of course, when you're not at the workplace, and potentially encouraging healthy food if you offer food on site or locating somewhere that's close access to healthy food. A little more difficult at home, but there's still ways to be able to do that. Enabling physical activity throughout the day, we know that strengthens your immune system, and promoting healthy sleep habits through circadian lighting. The sixth strategy we have here is maintaining water quality. Now, this might seem like, well, of course we should do it, but it's actually becoming a huge issue when you have these buildings that have been sitting vacant. They're not meant to sit vacant, right? Just like we're not meant to sit all the time. We've had the first case of Legionella come out because these water systems haven't been maintained. So we know the exposure to a range of contaminants in water can result in negative health impacts, including the spread of infectious disease. Water is typically treated with chlorine to keep it free of pathogens, but if left vacant for any length of time, it can lose its disinfection power, and it creates the opportunity for pathogens to contaminate the water. It's, again, really important as buildings start to think about reopening. So some of the features that are linked to this, really fundamental water quality, making sure you haven't got total high levels of coliform, you haven't got bad turbidity. Water contaminants is often making sure that you don't have heavy metals and other things and pesticides in it. Enhanced water quality and water quality consistency. So we have a section, a chance again to be able to ask some questions around strengthening the immune systems and maintaining water quality. Happy to take any questions.
Great. So one question for you, Angela. As we've all become very, very aware. The COVID-19 pandemic has disproportionately hit certain areas in all of our cities, and I'd be curious to know what other trends you're seeing and how immune strengthening initiatives can help with some of these challenges.
It's a very good question. So we know that certain communities that live in disadvantaged neighborhoods, for example, that have a higher, more exposed, communities of color, statistically speaking, tend to be more exposed to industrial pollutants than non-communities of color. And this increases, we know that there's been studies that come out of China that if you live with worse air pollution, you have a higher chance of dying. If you catch COVID-19, you have a higher chance of dying from COVID-19. And for many other complicated reasons, including, let's be honest, systemic racism, communities of color often tend to have higher incidences of some of those comorbidities that also increase your chance of dying should you contract the disease. So a lot of this has to do with access. A lot of this has to do with access to care, living in neighborhoods potentially that doesn't have access to high quality food. Sometimes we call those food deserts. There's just convenience stores and that's it. Living in areas without safe access to physical opportunities for physical activity. It's all great and fine to say you should walk every day, you should exercise, but if your neighborhood isn't safe or you have to cross a giant freeway to do that, that's not good. Those are all complicated urban planning factors, and we call those social determinants of health factors that influence your health status and can mean that you either start off with a fairly robust immune system, or you start off with potentially a reduced immune system, which makes you more vulnerable to those, becoming very sick with COVID-19. Immune system is quite complicated. They've seen that some people catch COVID-19 and recover, and others seem to get into what we call a cytokine storm, where your own immune system goes into overdrive. And once you get into that stage, it's really touch and go whether you'll survive. They're not sure entirely why certain individuals are more susceptible than others, over and above if you have some of these comorbidities. There's a lot of different theories running around, but what we do know is that urban planning, how we design in our communities, equitable access, a lot of the smart growth, a lot of these urban planning, healthy eating, active living initiatives really will support different communities be able to have better immune systems to be able to better weather the storm. One last thing I'll talk about is that there's some great interest and research coming out with the microbiome. We had a webcast on this, I think, 3 or 4 weeks ago, which is available on our website. It's all recorded. And there's been some great work. They said that really if you want to increase, have a more diverse microbiome, which is good. We want a diverse microbiome both in your belly and in the building. You want to have pets, you want to have plants, you want to have fresh air, you want to get out into nature. All of this will expose you to a diversity of bacteria, which means it's harder for bad bacteria to take hold. That one way of also increasing your diversity is to eat a lot of fiber and fruits and vegetables. This really can also help strengthen your immune system. So lots of different things at different scales. Individual actions people can do, actions that are really needed to happen at the community level, actions at the building level can support, for example, by promoting physical activity, breaks for physical activity, promoting access to healthy food, promoting reduction in stress, and levels and things that can happen at a city and a regional level.
Thank you. You mentioned water quality and immunity, which I was sort of surprised when I saw them bundled together, but it makes so much sense. And I'm wondering, in the context of buildings, given that a lot of the audience, either building owners or operators or tenants, what are the risks of leaving a building vacant for a long period of time in regard to water quality? And should people be thinking about best practices for adequate filtration? Should they be making upgrades to water systems? What's your quick response to that?
Yes, they should be concerned. And in fact, our water quality, our water concept lead just did an article on that. It's also available on our website, Rodolfo. Building systems need to be fleshed out. is the short answer. If they've been sitting vacant for a long time, anything where the water could potentially be stagnant, the water should be tested. And same with the air quality, right? The air should be flushed out, air quality should be tested, but particularly there's risk, particularly anything with an HVAC system. Legionnaires or Legionella is really a system or an outcome of HVAC systems. You don't see it in countries with HVAC systems, but anywhere you've got potentially the accumulation of mold, you've got the potential accumulation or, of toxins, or the chlorine, again, as we mentioned, isn't working, should be flushed out. And I know that especially higher ed institutions, so big campuses, the facilities managers are asking these questions already, saying, if we're going to bring students back in September, or even some students back in September, what do we need to do to our facilities to manage this? And definitely don't just dive in without any kind of systems checking and flushing out. Great. Want to make sure that we have time to go through all of our strategies here. So fostering mental resilience. So you see, we've tried to list these in ways that you can fit into your own resilience plans or your own recovery plans, or even your own prevention and preparedness plans. This is our 7th strategy. We know that mental health is a state of well-being in which individuals are able to live to their fullest potential, cope with the normal stressors of life, work productively, and contribute to their community. We also know there's a lot of stigma around mental health, which it seems is lessening a little bit as we see a lot of discussion in the media around it. We talk about a crisis of mental health, and we know that chronic stress is associated with increased risk of depression, cardiovascular disease, diabetes, and upper respiratory infections. All of them not great as comorbidities for COVID-19. So what we want to support is ways to help reduce stress. And this can be through many different ways, and we'll get into all those strategies in a moment. But the one we're highlighting here is access to nature and daylight. So we know there's about 40 years of research, this is one of my own areas of expertise, that a connection with nature through plants, water, light, and views, or even through indirect connection through, say, materials, patterns, colors, or images, that's called biophilic design, has been found to improve mood, recovery from stress, and improve concentration. And the recovery from stress here is really key. There's great data on this, that even something like 40 seconds of viewing pictures of nature on a screen can improve your concentration and improve your creative thinking as well. And breaks from work are really linked to employee well-being, higher life satisfaction from mood, sustained workplace performance, lower burnout, and fewer health complaints. So it is difficult to do that maybe when people are working from home, but encouraging them to take breaks, encouraging them to go out for walks in sunlight. It's really important. Actually, there's great research that in 6 minutes, the virus can be deactivated in sunlight. And access to nature, as you mentioned already, can improve your microbiota, all of which improves your immunity. So the strategies and well features, again, all of these are discussed in detail in that PDF that's available. Mental health promotion and education, stress support. This really includes making sure you have options for rest and recovery, seeing what kind of workload you have. Is the office designed, or in this case, the work from home designed, to be able to support the tasks you need to do. Restorative opportunities and restorative programming. Really, really important when people tend to be working longer hours just to get those same hours in if they've got maybe not the best work from home situation. And then providing access to nature and daylight. So access to nature and light exposure and education, really, really important for creating a biological and psychological and emotional resiliency around health. So the last strategy that we have here is champion community resilience and recovery. This is an interesting thing. You might think, well, why are we talking about this if we just deal with buildings? We do have a well building standard or a community standard, but it's really important that both as an organization and the location in which the organization exists, that there's something to come back to after the pandemic has passed. So we know that providing spaces for community engagement and connection has been linked to positive mental and physical health outcomes. And we also know that individuals, community, and social support generally have better mental health than those without strong community connections. We've seen an epidemic of loneliness, people working long hours. Being able to provide some of that sense of community is really important. And a hot topic right now, given that people tend to be really isolated from their colleagues, and it's really asking questions about what can that physical workplace provide? And one of the answers that seems to be coming up is this sense of connection, a sense of community, which may make trust easier and may make collaboration easier. And one of the features we decided to focus here on local community recovery. We know that pandemics can disrupt supply chains and can worsen food insecurity globally. Local food networks can provide some security during the disruption of national global supply chains by supporting small and medium-sized farms. Something like a community-supported agriculture can do that. And engaging with local suppliers can also result in social benefits and healthier eating habits. So some of the features that cover this kind of work is supporting local communities and fostering community connections, civic engagement, encouraging civic engagement. There's great research that actually shows that volunteering or having opportunities to participate has incredible stress reduction benefits. Some have linked it to the equivalent of getting high. Surprising but true, and encouraging community access and engagement. So sometimes pre-pandemic, that has been offering up common spaces for community use or fostering those connections. We know that people that have a sense of pride and a sense of engagement tend to have a higher sense of engagement. And there's some that have argued that engagement might actually be a better metric than performance and better metric of productivity and performance than traditional metrics. And providing access to localized food sources. So we support in the WELL building standard local food production. So that can be on site if you have a campus or we have a large place, and supporting also the local food environment. That can also include locating in an area that has easy access to healthy food and options instead of locating somewhere there's basically a food desert and you have to drive to get to. So we have time again for some questions.
Yeah, so you mentioned light as a disinfectant, and I'm wondering if you don't have access to natural daylight or you don't have an abundance of it in a building. I know that there's been a lot of research that you've been uncovering about UV light and its disinfectant properties. Would you highlight a few of those that you've been seeing?
Absolutely. So UV disinfection has been used in hospitals for quite a long time. Generally speaking, it's done not necessarily at eye level because of the potential dangers at having an eye level or getting into your eyes. Certainly organizations can invest in UV disinfections. That research is pretty hot right now. It's a potential, it's not the cheapest option, but it is a potential. I have seen some research that some sunlight that comes through windows may still have that disinfecting property. That's pretty hot off the press research, and we probably need a few more studies to corroborate that. In the meantime, enabling people to get outside and get fresh air and access to sunlight is a very effective way to try to reduce the chance of the virus. There's some great research that came out of the 1918 pandemic. One of the Boston hospitals had an open air hospital, and by putting patients outside, they were able to reduce the death rate by 35%, which is enormous. So getting people outside, getting natural ventilation in there, really effective way, also gives them a mental break, gives them access to outside. If you have access to a deck or any kind of outside space like that, I know those green roofs and other sort of decks are increasingly popular. Finding some way to encourage that use and make it a pleasant place to hang out for a few minutes might be one way to do that, as well as providing a mental break. I think the technology for UV disinfectant is still emerging for commercial use versus healthcare use, but there definitely has been some great research on promise in that. So that's something I would say stay tuned on.
Thank you for that. One question that came in from Tom that I'll give you in two parts around physical architecture. That maintain indoor gyms and athletic facilities, especially in big cities, you see the over-amenitization of buildings. And now we're rethinking how we operate those spaces. And I'm wondering if you see any indications that these spaces are no longer going to be in demand, or should policies be targeted toward directing physical activities toward outdoor spaces? What do you think about that and the approaches?
For the moment, definitely outdoor spaces. In fact, we've seen some great articles arguing for the usefulness and importance of urban parks. They've just been packed right now, and with good reason, which has other benefits as well, ecological benefits, mental health benefits, exercise benefits. But of course, you can't exercise outside forever, especially if you don't live in California. And of course, there's some things you just can't get quite as easily outside as you can inside. So it's very specific gym equipment or weightlifting is a little harder to do outside than it is inside. Definitely, it's going to be an uphill battle, because anytime you're exerting effort, you're more likely to release droplets, which has a higher rate of infection. At the very least, organizations in gyms like that are going to have to look at their ventilation systems and a higher cleaning protocol. So increasing the proportion of outside air with the appropriate filters, of course. We've had some indication that a MERV 13 filter can be quite effective, and making sure that, say, for example, the air from that gym area doesn't go throughout the rest of the building, which we've seen in hospitals, keeping that contained, increasing the rate of outdoor air, and increasing the rate of disinfection. Not maybe popular if you're exercising hard, but in enforcing universal masking until the pandemic reduces or is under wraps is probably a good idea. Those countries that had universal masking procedures did not need to shut their economies down and had much lower death rates.
Interesting. I guess on that note still, one thing to add to this question, or I guess one observation I've had, is a friend that lives in California has gyms that are opening up now. And what they've done, their approach has been to move to a scheduling structure where in order to go to the gym, you have to book a time slot. And that could be applied to building amenities as well, and just limiting the capacity and documenting who is going in the building at what time. I've actually seen that in a restaurant as well recently, where they had a list, basically a check-in list to show what time you were there. And in the case that somebody were to report having gotten the virus, they would be able to have that sheet to inform everybody. So they're doing a much more manual version of tracing, but it's one that definitely can be effective in just managing who's coming in and when and how many people.
Absolutely.
Yeah, and then with the sort of bigger picture, with access to nature, biophilia, another question we had was research relating to artificial greenery and improved mental resilience. I know that's something that is sometimes debated over whether or not artificial greenery has the same effect as the real thing. And I know you've been looking at that quite a bit as well.
Absolutely. Yes, this is my area of expertise in particular. In fact, I just had a book that came out recently on access to nature and green space and health. The research that we've seen so far on fake plants and fake nature, while a little bit better than nothing, people know that it's fake. They know that you put AstroTurf there instead of like a garden. They know that it's a fake plant. And there's the indications we've seen so far is that inauthenticity doesn't sit very well with people's perception that you are caring for their well-being. Real life plants, people know intuitively that it's something living. There's something that speaks to them about that. It symbolizes, nature is very symbolic, and it symbolizes other things for people. That's why sometimes even having a plant in your desk, particularly if they're grouped, a grouping of plants or a green wall or something like that, the research so far is signaling that could potentially be a habitat, and it makes us think of other experiences in nature that we've had potentially in childhood or outside the city. There's some great research on that and the connectedness to nature and symbolism of nature, which fake nature just doesn't have. And people tend to be a little disappointed, like, oh, you couldn't even put a real plant in here. We just came out with I just actually last week did a presentation with the International Living Futures Institute on what research about access to nature and health can be applicable to the workplace and why. What are some of the strengths of that research? What are some of the limitations? And that resource we're going to be coming out, we've had it ready to go, it just got put on hold with COVID-19. That resource will be available soon on our website as well. So if you wanted more detailed discussion around benefits of different types of nature, what the research actually says to take to your managers or your CEO or your clients around importing nature into the space, that contains it, as well as some common worries about, say, bugs and allergies and other things like that.
Thank you.
Welcome. I think we have chance for one or two more questions. I'll just move to the end of our slides here that show the well strategies in action as a recap. as well as we have a Places Matter webcast series. These are some other things that are coming up: work on equity, people and planet, venues and large gatherings, sports, and I think the sports and entertainment advisory just started up, correct, Dominic?
Correct. And then one thing that has recently been launched, so these guidelines that were mentioned, and then this resource specifically, was born out of a task force, as Angela mentioned earlier, that is continuing to develop more deliverables and more solutions over the next several months. And so one other thing that came out of it was a health and safety rating, which is designed to directly address COVID-19 response and to help people approach reopening their buildings. It was originally launched for sports and entertainment venues, but it's now being applied more broadly. And that is a program that was just launched, or at least just publicly debuted online just last week. So for anybody that wants more information on that program, I'll actually just post the link in the chat, and then we can upload that to the resources page I think Tom mentioned.
Right, and that I think is particularly aimed at facilities managers. Like, what kinds of things can you do to make sure that you're taking all the actions that are available to you to ensure the health and safety of people coming back to work? Do we have any other questions or final comments? I know we've got a couple minutes left, and I want to be respectful of people's time.
I don't see anything coming into the chat, but one thing that I've been personally interested in, along with my counterpart, Jason, who I've been working under, is policy and what the policy implications are after this pandemic. And if you look at zoning and building codes, they have always been rooted in public health. And the building codes in New York City were really a response to the cholera epidemic. And so as we move out of this over the course of the next year, I've been very curious, we've been very curious as an organization, what those policies will look like to protect us for the next 100 years. And I think we are seeing some areas that are very discussed, such as indoor air quality, all of the areas that Angela had covered today. I think some of them do have policy manifestations in the long term, and especially as it relates to disparities in low-income communities. And that's something that we really focused on in the past year with the partnership with Enterprise Community Partners, leading affordable housing organizations. So we do hope that this will help us create a better and healthier world, and by way of urban planning and policies that can really serve as the tools to make this happen. And then I think that we're also looking at different relationships with, say, the U.S. Conference of Mayors, and revisiting resolutions in response to COVID-19, and really rallying cities and local governments at all different levels. So lots more to come. And I do think of this very optimistically. We all do, because it definitely is accelerating a lot of really great progress that maybe would have taken a lot longer to come. So on that note, I kick it back to you, Angela, for any final thoughts. I don't see any, or I do see one more question if we want to jump into that one. What do you think?
Sure, yeah, just a quick comment about resiliency. The city level planning we've seen for a long time, city and sometimes state level has usually jumped as being in advance of, say, federal level response for many different reasons. And cities have already signed on, say, the Rockefeller 100 Resilient Cities Initiative, which in many cases has taken into account equity, which links health, which links ecological resiliency. And so we're seeing, I think, a convergence between individual or organizational level resiliency, or something like the 2030 district linked with larger levels of resiliency and individual resiliency. I think this is a great opportunity to make that connection between the kinds of policies, for example, around energy efficiency that will really improve air quality, for example, and then seeing that link to individual resiliency with better air quality and improved immunity. So lots of opportunities here. And please check out our Places Matter initiative. All the recordings or all the webcasts to date are recorded, and any of the resources are free and available. And I think that's us at time. Tom, did you want to say any final concluding remarks?
Yeah, no, I just wanted to thank both Angela and Dominic for taking the time to be with us. We certainly appreciate your expertise in this unique opportunity to discuss the WELL standard in general in response to COVID-19. Well, the Cincinnati 2030 district is the first 2030 district in the country to tackle occupant health as a pillar for measured improvement. And our health working group has been proactively engaged with WELL and IWBI in developing that standard, which we look forward to rolling out in the subsequent months. If any of the participants in this meeting would like to ask any specific questions to the 2030 district, you may reach out directly to us, Tom or Elizabeth. We will also post this recording along with all of our resources that were mentioned in the chat to the 2030 District Library page in our YouTube channel. And I just wanted to, I wish that Zoom had a better platform to allow for mass applause, but we have not paid for that built-in soundboard effect yet. But I would just like to thank both Angela and Dominic for taking the time, and we sincerely appreciate your sharing your expertise today. Thank you so much.
Happy to do so.
Thanks,
Thanks, everybody.
Bye.
Stay safe.
Take care. Thank you.
Bye then.